Do you suffer from asthma, migraine, back or neck pain? If so, you'll want to know about a complementary therapy that is rapidly gaining popularity in Ireland. The Bowen technique has helped thousands of people, and here to tell us all about it is Barry Harpur. You're very welcome.
Thank you very much.
We're also joined by Joanna Farrell. I'm going to talk to you in 2 seconds, Joanna. Barry, the Bowen technique or the Bowen therapy, either, how would you describe it?
It's a soft tissue therapy. It's based around a series of rolls or moves over specific muscles and tendons in the body. It was pioneered in Australia by a man called Thomas Bowen, hence the name, and he basically worked intuitively, developing these skills and doing these slight moves over years and years and building up a repertoire of moves, and found that he could get some fantastic results just by doing the smallest of rolls.
Just by touch, or is there a technique to the touch?
There is indeed, yeah. What we look at is skin slack, so the best way of explaining it is...
explain it on my hand there. Can we use my hand just to...
For the skin slack, we imagine that we've got a piece of super glue on our fingers here, and we stick our fingers onto the hand and we draw the skin slack back, so we're not sliding over the area.
Do that again, you're drawing.
So we draw the skin slack back. We apply a little bit of pressure, which we call eyeball type pressure. So this is the type of pressure you could apply to your own eye. So it's very, very gentle, which means it's very successful for, you know, babies, for older people, for
any age group.
Any age group.
And how, I mean, if you have had serious, you know, any sort of serious condition, like if you've suffered from a stroke or anything like that where you're, you know, you're paralyzed, have you seen any real significant
Absolutely.
results?
There's no contraindications to the technique, so there's nothing that we cannot treat. And we don't actually treat conditions, so I don't treat specific conditions. I treat people with conditions. So we look at the bigger picture. You know, when people come in, they say, I've got a particular problem. We try and treat the person and see how they're being affected.
It's complementary therapy, but has it proven to work with medication, as we know?
Absolutely, yeah. And the key is it is complementary. It's not alternative. And you know, we're working with GPs, we're working with physios, chiropractors. So
great, though.
Absolutely.
And have they embraced it?
They have indeed. Across the water, you know, in the UK, you know, there's physios across even into Europe using it now, and in Ireland. So we're running courses now.
So kind of more and more on this program, you know, we do these items, and it's the magic of touch.
That's it. Yeah, absolutely.
I mean, you have to be obviously experienced and know what you're doing. You have to be trained in it.
Absolutely. We're running courses now for the first time in Ireland to train people and try and get people involved, from the layman, from the bricklayer to you know, to experienced practitioners.
Joanna, you suffer from frozen shoulder.
Frozen shoulder. What happened to me back in March of last year, basically I couldn't move my arm upwards above this level. And
so you could only bring it to here?
That's all. And after months and months, I picked up an article in a magazine, and it was about Barry, and got in touch, and lo and behold, I did 2 sessions with him, and after the second session I found that I was able to freely move my hand and start to do the things that I was doing.
It's now working again.
Exactly.
Okay.
Exactly.
Would you show me, Barry, what kind of treatment tell me actually what you're working on?
Okay, well what would happen is initially when Joanna comes in, we do a full back treatment, so doing small moves over the back. Then when we move on to the shoulder, for the case of Joanna's frozen shoulder, she couldn't actually lift her arm above around 35 degrees. So what we do is we take the arm and we do a small move just over the shoulder here.
Yeah.
And as we do that move, we carry the arm across to the other side of the shoulder. And we just do a small jar on the edge of the shoulder, like this.
What's the jar about now?
The
it's a
jar,
little jolt.
that's it, a little jolt just across. So we're opening up this joint
is that
here.
Sore?
Not at all.
No.
Very, very light. And that's the whole key to the technique. So as we bring the arm back, we do another little roll, once again, over the actual shoulder here. And that's it for the actual, the move for the frozen shoulder. And Joanna would come back and she'd see me maybe 2 or 3 times. And in most cases, we get some fantastic results where the arm will come up all the way up above the head, so where they haven't been able to move their arm.
Okay. So depending on what the problem is, you'd be 6 weeks at it, or could you be a year at it, but spread out?
Generally, we say 3 to 5 treatments for specific conditions. After that, people come back, they might have a maintenance where they come back once a month, because it's not only about treating conditions, it's about treating, you know, the well-being, feeling nice.
What caused the frozen shoulder?
I don't know. Really, I thought it was stress, maybe the children, you know, lifting kids in and out of cars.
And with frozen shoulder, it can come in and last for 3 years, and people go around with this pain for a long, long time, and for something
because there's
so
a lot of
simple.
varied reasons out there why it happens. You know, they say it's stress. It could be. I mean, diabetics can suffer from it as well. It can be circulation. But in your case, you don't really know. You're not sure.
No.
You're obviously feeling a bit better.
I
The
am.
first treatment, when you know when you lift her, can you do that again? You know
Yeah,
when you lift-
absolutely.
was that not sore for the first one because you couldn't do it yourself?
Initially, yes,
Yeah,
it was.
yeah. I'd
So
imagine.
But what we do is to release all the kind of area out, we would do the treatment on the back of the body first, just to
Okay.
kind of free up this arm before we do it.
Now, you have worked on people with asthma, with migraines. How does the asthma work? Are you working on their chest?
We are, what we're doing is we're looking at the chest area, the cavity wall coming in around the diaphragm. So what we're trying to do is take the tension out of the diaphragm, especially with children as well when it comes into colic. Once again, there's a lot of restriction in the chest area, and we're just trying to release that tension out, just with a very, very gentle move.
Again, there is a technique to it. It's not like
There
you
is
can just start doing it
not at
tomorrow
all,
on your
no,
own kids. Okay.
no.
And with migraines, what do you do?
Once again, we do a body treatment on the back, then we get the client to turn over, and we do some small moves around the neck area here, coming
Okay.
on to
Yeah,
the front
shows
of
that.
the area here, and then we would do a small move just on this area here and do a little bit of drainage coming down. It's what we call lymphatic drainage, and just do a slight squeezing of the muscle
So is
there.
that like when they talk about sinus problems that you need to do the same thing?
That's it, absolutely. Congestion all around the neck, throat and head area, and this is fantastic.
And has this taken off in Ireland? Are people interested?
Absolutely, yeah. There's a register now called BEATER, which is a Bone Therapist European register. At the moment, there's a certain number of people on there that are properly registered, have a code of ethics, and they're trained in anatomy and physiology as well. And it's getting kind of more and more widespread across
And as
the
you
country.
said, it's complementary. It can work with medication if you
Absolutely,
are on a
that's the
certain
key thing here. It's got to work with other things as well.
Okay.
You know, people come for treatments on their own because they enjoy the whole experience, but it can be used in conjunction with others.
It's absolutely brilliant. And tell me this, when people come to you first, are they apprehensive? Are they a little nervous?
Absolutely.
If they don't know what they're doing. You know, I can understand that.
Yeah, and also because of how light the touch is as well, a lot of people kind of wonder, you know, what actually is going on. The key point to Bowen is we take breaks during the treatment, so I might do maybe 3 or 4 moves on Joanna here, and I say to her, I'm going to leave the room now for about 2 minutes, and it's very strange for some people to sit there and they say, what is this guy up to? You know,
Yeah,
he's
why
out
do
of the
you do
room.
that?
What we do is we put the body into a state of relaxation, and we want the body to repair. We've got to give the body time.
So it's time and healing.
That's it, exactly.
Okay.
Yeah.
And why do you think have we gone away from the whole touch thing? You know, have we spent so many years, not obsessed, but taken up with medication and sort of experts on the other side of it?
That's it.
Now, you say it works as complementary, but have we forgotten the power of touch or something?
I think so, and we also forget that the power of the body and its own power to heal. You know, we've got a huge ability to heal ourselves, given the right direction. So the Bowen move as such, is just like a signpost to the body to say, you know, let's have a look at this area.
You have another method, and I just read about it, that before you start a session, you try to reconnect the head with the body. What's that about?
That's it. Well, there's a lot of confusion going on between the left and right side of the brain.
Yes.
And the technique is about stimulating the central nervous system. So the best way to show the confusion that goes on, if I could just get you to put your hands out like this, and if you put the hands across.
Oh, yeah.
Okay. Now we're going to close our fingers and interlock our hand.
Okay.
That's lovely. Okay.
I should have gone the other way. I'm sore. I think I'll go again.
Okay.
Do you
try it
mind?
again.
No.
Okay.
Better.
So what we're going to do is we're going to point to a finger and just ask you to move that particular finger.
Which one?
Exactly. So move this finger and move this finger. So the brain becomes very
move that finger.
confused because
Am
we
I
don't...
that? Does that mean I'm really unfit?
Well, no, not at all. But what happens
Feels
is
unfit.
when I point to the finger, the body actually becomes confused. It doesn't know what finger I'm pointing at. But if I introduce the element of touch now and say, right, if you could move this finger and move this finger,
That's
we
quite
see
immediate.
automatically it makes this link, and the body makes that brain-to-body link.
And why don't we do that automatically? Why don't we do it all the time? Have we forgotten how to do it?
No, not at all. What happens is we've got about 6 million messages going from the brain to the body every
We're
second.
too busy, Joanna.
We're just
Too busy, Joanna. We're too busy.
Well, that's it.
If we did that every morning now, would that help us be a little bit sharper?
Probably not. You've got to continue with some more moves and that
Okay.
type of thing. But it just kind of illustrates the fact of how that confusion can go on. And it's the same with healing.
Are you on the road to getting better? Are you nearly there?
Oh, I am. Thank
One or
God,
two more
yeah.
sessions, or is she done?
Well, she's
I
coming
do
back
come
for-
back once a month to
Oh,
Barry,
very
just
good.
for maintenance and for relaxation.
Keep an eye on
and it's fantastic. I
Brilliant.
love it.
Well done. Thank
Yeah.
you so much,
No
Barry.
problem.